Thank you for having me. I think what I'm going to talk about has a lot of resonance with what's already been talked about by John and yourselves. We also use mental health first aid, and in fact on our work and health programme we've specifically trained all of our staff, frontline staff, including admin staff and other support staff in mental health first aid, because we feel it's really important as well as a grounding. Woo, went too far. So this is me. My role is head of practice or head of practice support. Sometimes I put the support on, sometimes I don't. But essentially I came to Shore Trust after a really long career history in the NHS and its equivalent in Australia and New Zealand. So I'm originally from New Zealand, so they paid for all my training and now the UK has benefited. But through that career, I've worked with a really diverse range of disability groups. So I've worked with mental health, I've worked in neurology, I've worked with older people, I've worked with physical disabilities, I've worked in reablement and rehabilitation services. And my last job in the NHS was actually managing allied health professions. Does anyone know what an allied health professional is? Yeah? Couple of nods? Okay, an allied health professional is all of the professions that are related to healthcare that aren't attached to medicine or nursing. So you have physios, you have OTs, you have orthotics, you have prosthetics, you have speech and language, and a whole range of like operating technicians and all kinds of roles within that allied health professionals group. And we're all qualified, registered professionals. We all get registered through the Health and Care Professions Council, so HCPC. So if you ever see HCPC, that's what it stands for. So we're all the allied health professions within that. So we're registered professionals, and as John referred to, we have ensured that we've passed that through the health and wellbeing team that we've created within Shore Trust, because we see that as a really important factor, because those people are responsible for keeping up their skills. You talked about things change all the time. Nice guidance. I have to keep abreast of all the new nice guidance coming out from the Centre of Excellence so that I can invest that into the health and wellbeing practitioners and into the other programs that we deliver. So we talked about, we're going to talk about work and health because it links in with John's presentation, but we actually deliver health and wellbeing services in lots of other sectors across from our Shore Trust base. So we work in health and wellbeing, community mental health and wellbeing in Kent. We work with an IEP service doing wellbeing in Suffolk. We have IPS, which is Integrated Placement and Support Schemes in several places, and Thrive has recently come to Shore Trust through our merger with Prospects. So we've got a lot of other health and wellbeing services that we run that are specifically designed to work with people with different types of disabilities. Work and health is designed to work with any person that comes through the door. So, too many. Since it began, the work and health programme, there's been 38,000 referrals. These are the August statistics, I will say, because they're the latest statistical release. Of that, 86% of those people coming through and starting on the programme have a disability. As you said, 25% of those are likely to have a mental health disability, but you're only touching the surface on that. A huge bulk of them will have a mobility or a body condition that will impact upon them. Interesting, really interesting that 64% of the referrals are male, because Sports England did some statistics around disability, and actually 55% of females have a disability under the Equalities Act and only 45% of males. It's interesting our statistics are on their head in the other direction, and I don't quite know why that is, but it might be something that we look at going forward. 10% of the people coming through the work and health programme are 60 plus. The importance of that is how far away is that retirement goal for us now? You know, every time I turn around, it seems to be going a year further away from me. You know, I thought 55 when I was in the NHS, be retired by then. Lots of my colleagues did, but I missed the boat by 6 months when I came to the UK. I didn't get enough experience because of that. But it's moving and moving and moving. So that 60 plus group is going to have more level of disability. They're going to have more complex conditions. 50% of people have a long-term condition. 50%, okay? A lot of those are in the older adults group, but 75% of that 50% have more than one, and that's where you get extra mental health needs. Because if you have a long-term condition, the chances are you will probably become depressed. You will probably have a level of anxiety because of the impact. 50% of people with long-term conditions have pain all the time. Can you imagine living with pain? And some of you may do that yourselves, living with pain every single day of your life. It wears you down, it tires you out, it makes you fatigued. All of those impact on the people that we're working with. So what can we do about it? Because it's a challenge. It's a big challenge. It's a complexity challenge. There are thousands, millions of conditions out there. No one person can know them all. Your GP doesn't know them all. No one does. You know, why do they say, oh, well, that's one in 5 million people have this condition that you have? You know, I've heard of people being diagnosed with conditions like that. It's a challenge. It's complex. It's emotional. You see in the people that you're working with in the program, the conditions and people in your own families, in your friends. It's emotional for you to take on that, and it's emotional for them to be experiencing those conditions. So there's a real intensity of emotional exchange. People need to understand what we mean by adjustments. You know, we talk about reasonable adjustments, we banter it about, but there's a lot of different types of adjustments. Access to work does really well on some quite, I would say, basic physical adjustments. But when you try and get mental health adjustments through access to work, it's much more challenging. So if somebody can't travel on public transport because of their anxiety, far less likely to get a personal assistant than somebody who's in a wheelchair. So there's not a parity of access there yet, and that's a really important thing. But our advisors need to understand that there's a whole range of adjustments out there so that they can help the people that they're working with. We want everyone to recognise that the people they're working with are assets in themselves. I've just put this in a bid that we're writing at the moment, but it's really important to see people as assets. They come with a whole set of experience, knowledge, skills that you can't pretend disappears just because they have this disability or this health condition. But a lot of people just focus on the health condition. You know, we see John looks ill today. He's been ill for 3 days, so have I actually. But we don't focus on that. We focus on John as the person and the presenter and the information and, you know, the nice jumper you're wearing today. But we think about John as a person, but quite often when people have disabilities, they're forgotten about as people. They're seen as a label. They're seen as the disability that's sitting in front of you rather than a person. So we want people to see, we want our staff to see people as assets. And we want people to understand the functional impacts of disability. So I had a couple of children. I was a working mum. I worked part-time, and I often looked at, you know, other people I knew who were struggling with things, who were working parents, and how hard it is sometimes to cope with the functional things that you're struggling with alongside working, alongside a parenting role. And it's really important that we don't forget about some of those things. And if anyone tries to use public transport, in most cities in the UK still, if you have a level of disability, it's a challenge. It doesn't matter where you live, it's certainly still a real challenge. So understanding that people aren't just being difficult when they say, I can't do that job on the other side of the city, even though I've got the right skill set and I'd love to. It'll take me 5 hours to get there because people have to get the ramps out at every railway station. And sometimes they forget and I'm stuck on the train, which I've heard of happening as well. So it's really important that our support managers understand those functional aspects. So what's our solution? We have a health and wellbeing team. It's not necessarily new. We created a health and wellbeing team within Work Programme and Work Choice when we were running those contracts. But what we've tried to do differently in the Work and Health programme and in our other programmes is that they become a resource for those team members. So they're working alongside those support managers or those community navigators or those employment advisors, because we've got all these different names of people on different contracts, but they're working alongside them to upskill them, to support them, to help them with the language, to help them with the direction. And as John mentioned earlier, we've also brought in a skill set around reflective practice. Has anybody heard of reflective practice before? Okay, a couple of people in the room, not a great deal. Reflective practice is something that I've brought from the NHS, if you like. I've brought from my clinical background. There we call it clinical supervision, and we are all accountable to have it as clinicians. So every clinician that you work with, whether it's a doctor, a nurse, an OT, a physio, anyone else, will have clinical supervision. So it's kind of baked into our psychic, if you like. We're trained that that's a really important aspect of our role. However, not quite so trained into the role of an employment professional. And I'm sure I'm not causing any ruckuses in saying that. So we wanted to actually do that. We wanted to bake it in. But of course, you can't call it clinical supervision. You're not clinicians as employment professionals. You're professionals, you're practitioners, but not of a clinical nature. And we didn't want to call it supervision because everyone has supervision already within their services. Your line manager supervises you. So if we started calling it supervision, people would go, but I already see John for my supervision, so why do I need to come and see someone else? So we looked at what it actually means to do that practice, and we came up with the term of reflective practice. I'm going to talk a bit more about reflective practice, but I also wanted to think about resilience, because resilience is the other thing that goes alongside, and it's resilience for the people we're working with, but it's also resilience for the staff. As I said, it's an emotional job when you're working with people with lots of complexity. So we wanted to look at how reflective practice and resilience work together. Yeah? So people, I like the image of resilience being the what I call the Tigger effect. I don't know if people, Tigger likes to bounce, and resilience is about bouncing. It's about being knocked down and getting back up again. Yeah, and we all can think of people we know who we see as that really super resilient person. They've been through every strife and struggle in life and they still greet you with a smile. And that's what we're talking about, and that's what we want to bake in for staff and for the people using services. So how do we bring all of that into one sort of focus? Are people familiar with the 5 ways to wellbeing? There's again a couple of nods around the room. 5 ways of wellbeing have been around since about, I think it was 2008. I was actually lucky enough to be one of the people involved in the launch of the 5 ways to wellbeing when it came out in a Foresight report. Foresight was a government think tank that was asked to look at mental capability. And they were asked by the government to think about a simple way of supporting anybody to improve their wellbeing. So the 5 ways to wellbeing works for anybody. It will work for you, it will work for your clients, it will work for your mum, your dad, whoever, your children even. So we decided to bake in the 5 ways to wellbeing into our services and use it as a way of developing resilience. So these things are just some ideas of what you can do with the 5 ways to wellbeing, but really it's a huge potential in different areas. So taking notice, being more mindful. Mindfulness is growing in its respect, I guess, in a lot of businesses now. A lot of big companies in London and other places actually run mindfulness sessions. But the simple way to be mindful is to take notice. And if you think about when you were coming here tonight or this afternoon, did you take notice of anything other than head down straight out of that train station or that office straight to where you wanted to go? And that's what we tend to do nowadays. We don't tend to think about the world around us, we tend to just focus forward. And it's really important for us to take a moment and stop doing that. And that will help our well-being and it will build our resilience. Being active, everybody knows, the government's always telling us we need to be more active. But it's actually really quite scary how inactive people are. There are people in the UK who don't do 10 minutes walking a month. A month. I was horrified. I've got one of those apps on my phone that measures your walking, and I was working from home one day and I did less than 800 steps and I was horrified, and it made me think I've really got to move more every single day because I'm doing so little. And actually they talk about the fact that we sit down all the time will be the new epidemic of our modern society. It will kill more people than any of the other diseases that we have. So getting more active. Keeping learning. You know, we know, you know, most of us, like, you're all here today because you want to learn something, I'm presuming. But you're all here for a reason, and that is probably about learning, meeting new people, having new connections. So that links us on to connecting with other people. Amazingly, as soon as you have a disability of any form, particularly a physical disability, but also mental health, you become more isolated. It's almost like a switch. And that's really, really hard for people because we're born to be amongst a group of people. We're born traditionally in family units or in tribal units. We're not born to be on our own, but more people live on their own in the UK now than ever before. I was just looking at some statistics today for Kent, and that one of the areas in Kent, sorry, the lights have just gone off, is a place called Thanet. And if any of you know Kent, Thanet is a very deprived area, but it has the highest rate of income deprived people over 60 with disabilities, and it has the highest rates of loneliness. So income and deprivation and loneliness and ill health all wrap around each other. It's very hard to separate that. Doesn't mean rich people don't get ill, because obviously they do, but it has more impact on the people we're working with. And the chances are the people that we see coming through all of the programs that we do are likely to have a higher proportion of lower income or more income deprived areas. And then the last one is really simple. It's give, do something nice. And that can be really simple, from smiling, it can be giving something to that homeless person that you see, it could be doing something for a family member, it could be contacting a friend that you know is a bit down, anything like that. But actually, and if you talk to people in terms of volunteering, actually people volunteer because it makes them feel good. They don't just volunteer because, it's a nice thing to do for other people. It's a nice thing to do for me. And it's good to do that. So reflective practice, I've kind of talked about this already, but it's about having a chance to think through all of those things. It's about taking a step back and thinking about what you've just done and thinking about, how could I have done that differently? Could I have done that any better? Is there anything I would change about that if I was in that same situation again? And that's how people learn. People learn by reflecting on what they've already done. Yeah? We don't learn only by thinking about things that we don't know. So when we go to school, that's mainly what we're doing. We're learning things we don't know. As adults, we're better learning from what we're doing, learning from how things could have been different. And even when something goes really well, reflecting what made it go really well. What was so great about that situation? What were the set of circumstances that made that work? And that's what our health and wellbeing practitioners are doing and talking to our staff about. So they're taking people through that step back process, that opportunity to take time to think. Because the roles are really busy. You know, we've probably all got really busy lives. And actually it's sometimes really hard to fit in that time and space just to think and to reflect. And that's what's key to what we're doing. So reflective practice allows our delivery to be safe, because people are thinking about risks. People are thinking about, when something has gone wrong, how could I avoid that in the future? So it makes our delivery safer. And helps people to take those techniques away and do it for themselves. So it's not just when they're sitting in the room with the practitioner, it's about the other time that they have when they've got 5 minutes sitting on the train. If you're like me, you're on O2, I've got nothing on my phone anymore today, I've got no email, I've got no internet, I've even not got even calls now. So I can take that time and sit and reflect instead of going on social media. But it gives us the skills to be able to do that. It allows people to get some feedback. So I can say to you, well, you know, it kind of went like this, and then that happened, and I can get some feedback from that practitioner about, well, why did it do that? How did it do that? What do you think you were doing that might have promoted that or led to that? So it helps me to get some good feedback. It can be about increasing knowledge. Well, next time, have you thought about doing X or Y instead of A or B? And you might get a different outcome as a result. And overall, all of that leads to developing the capability of those frontline members of staff, which is what we're all about. And there's just a little case study. So this was a gentleman on the work and health programme. So we linked what he did and needed to do to the 5 ways to wellbeing. So he started running daily, so he was getting fitter. He was anxious, so we helped him to access a peer group with other people suffering from anxiety. He learned about what his own triggers were by taking notice, by thinking, by recording what was going on for him. He learnt self-management techniques. We have a whole string of self-management techniques that we share with support managers. And then he got the opportunity to give through our Tempo time credits program that John mentioned earlier, by talking to other people with similar anxiety conditions. And he developed skills and confidence as a result of that, reflecting what John said earlier as well. He learned how to manage his health condition, and then he moved into full-time paid employment. So it's a step-by-step process. And sometimes, as John said, you can't start with, let's get you a job. Sometimes you have to start with, let's help you get your life sorted. And that's what we're working with our support managers on the Work and Health programme and on all the other programmes that we work on. And that's the end.
Thank you.
You're welcome.